Hi everyone, I'm Dr. K.K. Durga Prasad, Senior Consultant Pediatrics, Ankura Hospital, Banjara Hills. I have with me Dr. Namitha, Senior Consultant Pediatrics from Ankura, Banjara Hills. The moment one is blessed with a newborn baby, there are thousands of suggestions coming from near and dear and family and relatives. So Namitha, this is very commonly seen when in our private practice. What do you think about it?
Yes, there's so many suggestions overflow to the parents, the new parents specifically, from all the quarters of the society as well as the elders in the family. But are all these always right is always the question which the new parents have. So let us discuss about a few myths and the facts about a newborn baby care.
The regular day-to-day practice, we have lots of questions from the parents who come. These myths have to be busted, otherwise we are going in a wrong way. So what myths are correct, what are wrong, we'll discuss on it today. The first myth is giving a bath to the baby as soon as the baby is born. What do you think about it?
The baby should not be given bath immediately after the birth because babies can get cold. Hypothermia is one of the common things what babies encounter when they're exposed to cold. So the first bath should always be delayed for as long as 24 hours to take care of the temperature as well as to protect the baby's skin. There is also one of the common suggestions that honey is good for the newborn babies and infants. Do you think it's true?
Honey to the newborn's babies, it should not be given till 1 year because honey contains a bacteria called as Clostridium which can cause botulism in babies. Most of the times when we visit the baby in the next day after the delivery, all the rooms with the babies will have a bottle of honey, which we immediately ask them to stop. The next point is whatever honey we are getting nowadays is not so pure, and that may cause too many infections to the baby and may cause vomitings and other conditions. So honey should not be given to a baby till 1 year. Namitha, the next common myth is saying giving water to the babies will help in digestion and baby needs water in summer season. How do you tackle this myth?
The babies after birth till 6 months of age should be exclusively breastfed. There is no need for water as breast milk, as well as if there is a necessity, the formula milk contains about 85 to 87% as water in its contents. The baby should be exclusively for 6 months irrespective of the season what they encounter, because that improves, helps in their hydration as well as digestion.
And nowadays we can say the water may not be pure when they give it before 6 months. The child may get serious infections and sepsis.
Yes.
So what they should avoid water.
They should avoid. As well as if you give plain water, we are compromising on nutrition because the water fills the tummy and baby is not getting adequate nutrition what they should be getting through the milk or the formula. One more common myth is applying kajal to the baby's eyes will avoid them from evil eye, as well as they'll make their eyes look bigger and better.
Yeah, Namitha, this is very commonly seen in the OPDs where when the baby comes with the grandmother and the grandparents, they apply a lot of kajal under the eye. There is a spot of kajal on the cheek and all over the face. So this applying of kajal should be avoided, as applying kajal on the eyes may cause reaction to the eyes because they have a lot of chemicals in it. So they may cause watery eyes and may damage the eye layer. Usually we say avoid kajal until they prepare it at home and apply it. Yeah, Namitha, one more thing, the frequently asked thing is shaving the baby's hair will promote thicker hair growth. What do you say about it?
It is a common custom among many religions in India to have a baby's head shaved during infancy. It is not necessary that it will lead to thicker hair growth. Most of the newborn baby hair are shed during the first 6 months and the mature hair usually grow. If we are shaving the head earlier, we are hastening into the mature hair growth, but it need not be thicker because the hair growth will depend on the follicle size rather than because of the shaving. One more doubt which many of the parents have, that the babies are born with a soft spot on their head. If it is touched, the baby may have pain, or it should not be touched is one of the common doubt which the parents have. How should we talk to them about it, sir?
See, the soft spot of the skull is covered by a thick membrane which will not directly damage the brain whenever there is something happening there. So this soft spot can be touched. And the most common thing they ask is it normal to have a soft spot? So it's normal to have a soft spot because the skull bones are not fused yet, allowing the brain to grow for the first 2 years, and for this soft spot will close and fuse by 1.5 years to 2 years. If it doesn't close after that, then we have to investigate on that baby. Otherwise, the soft spot is a very common thing, and it is covered by a thick and a tough membrane which will not damage the baby's brain, or it's not going to cause any harm to the baby. Dr. Namitha, the next commonly faced thing which we see in the common OPDs is putting oil in the nose and ears. How is it good or bad?
It is definitely a practice which we should not encourage. In fact, it should be discouraged completely. Oiling on the skin and massaging for the baby is good, but applying oil, instilling oil in any of the orifices, nose, ears, mouth, should be avoided. In fact, we see so many cases where the nose applied into the oil applied into the nasal cavity enters into the lungs, and babies land up with pneumonias also. So such practices should be completely discouraged. Common thing about clothing the baby, that baby should be clothed in multiple layers to keep them warm, always have caps onto their heads. How do we talk to the parents about this?
See, the common thing when we talk to the parent with a newborn baby is the keeping the baby warm. First thing is we ask the parents to keep the baby warm, depending on the ambient temperature, outside temperature and the climate. If the outside temperature is cold, then we ask the parents to wrap the baby in a properly wrapping the baby and covering the keeping a cap on the baby's head. And if it is warm, lighter clothing, but the baby has to be wrapped. There is a logic behind why should we wrap the baby. Because the baby has to be maintained at a certain temperature. If we maintain the baby at a certain temperature, only the weight gain of the baby happens normally. See, if the baby is taking milk and getting 100 calories, and if we don't wrap the baby in a cold temperature, the baby will use those calories in keeping the baby warm. So if instead we keep the baby warm by ourselves by wrapping the baby, the amount of calories the baby takes would help in only weight gain. So this will help the baby grow in a normal way so that the weight gain can happen normally. Namitha, there is another common myth saying that baby should not be taken outside. What do you say about it?
There is no harm in taking the babies outside, taking few precautions in which you clothe the baby properly to protect the baby from the ambient temperature. If it is a cold weather or if it is too sunny, have sun protection measures, as well as try to avoid catching infections. In a way, don't take the baby in very crowded areas, and practice good hand washing to make hand hygiene. As well as if there is anybody having obvious cold, cough, sneezes, try to avoid taking babies in those areas. Otherwise, babies can be safely taken outside. Many new parents are really worried about whenever the baby cries. So, and they try to feed the baby. If the baby doesn't feed at time, even the crying and distress of the baby as well as the parent keeps increasing. So, is always crying suggest that the baby is hungry?
Crying doesn't suggest the baby is always hungry. Crying can be the only way, the major way where the baby wants to show discomfort the baby is feeling. It can be discomfort. It can be any prick by the dress the baby is wearing, or it can be because of the gas, the colic pains what the baby has. So most of the parents, a newborn, especially the newborn babies, whenever the baby starts crying, the mother, the whole family will rush up to the mother and says the baby should be fed, the baby is hungry. And this in fact will cause the baby to have more amount of gas and colicky pains. So crying is not always a criteria that the baby is hungry. So the baby would be consoled with whenever the baby is hungry. When you feed the baby would be consoled. But if the baby is not, you are unable to console the baby even by feeding, then the baby has another cause for crying. Usually these causes there are 3 to 4 causes only. Once if the baby has a cold, or if the baby has stomach pain, or if the baby is not comfortable with the dress or something the baby is wearing. So crying is not the only thing where the baby shows for that the baby is hungry. It can be a thing for other things also. So always a crying baby is not a hungry baby. Yeah, Dr. Namitha, another common question, myth or whatever it is, they say the baby has not passed motion for a day and they think the baby is constipated. What is your say on it?
Many newborn babies as well as infants do not pass motions every day. It is quite as infrequent as from every second day to once in a week. Unless and until the baby is not showing any signs of discomfort, baby is feeding adequately, gaining weight well, passing gases, not to worry. If along with constipation, the baby is passing very hard pellety stools which are painful, then we'll be worried. As well as if there is tummy being bloated, the baby is been vomiting, in that case, the medical medical help should be sought. Another common concern what most of the parents have is whether the vaccination should be given during minor illnesses like cold and cough, or whether they should be delayed.
The first common answer from a parent when I see the vaccination date is delayed in the vaccination card, they say that the child was having a common cold or a mild fever. Common cold and mild fever are not contraindications for vaccines. They can be given vaccine. The vaccine should not be postponed because of common colds and mild fevers. It should be postponed only in cases of severe conditions like the child is having a severe infection where the child is on antibiotics and is being treated with a medical practitioner. Then the vaccine should be delayed till the baby gets well. Otherwise, minor colds and coughs are never a contraindication for vaccine. The next common myth is walkers help and learn the baby learning walking. What do you think? Is it useful or should we avoid it?
Walking is a natural motor milestone. Most of the babies achieve it somewhere between 9 to 18 months of age, and the babies will achieve it irrespective of whether you try to teach them or not. So walkers are not a measure in which you have to make your child learn how to walk. If you want to offer it as a toy, or if you want to give it as for the baby to mobilize himself better, you can start doing it, but don't do it too early. It should be done only when the baby starts crawling and baby pulls to stand himself or herself with the help of a furniture. It should not be done before that. And most of the times the walkers, modern walkers what we say are the round walkers in which the baby stands in the center. Those should be avoided because they don't really help the baby move forward and babies can trip over losing their balance. So use the walkers in which the baby goes in one direction rather than being in the center of the walker. So today we have discussed about a few myths and the facts about them. Which should be practiced or not to be practiced, but there are many more suggestions which we haven't discussed here. So how do we address about the parents to encompass all of them?
Yeah, once a newborn baby is born, there would be hundreds and thousands of suggestions, myths coming in the way of the parents who get confused too much about which to follow and which not to follow. Hope we have covered a few very common myths which are being put into the brains of the young parents. But there are lots of other suggestions which come on their way. If they think that that suggestion is good and if they want to implement it to to their baby, please suggest the pediatrician. Please consult the pediatrician before doing that to know whether it is right or wrong.
So let us combine age-old suggestions as well as the new modern practices for happy and healthy newborns. For more such information for the parenting tips, please follow our YouTube channel or our Instagram page. Happy parenting.
Happy parenting.